On this edition of Veterans Health Watch, we'll focus on heart disease, associated risk factors, and treatment options. We'll also hear from a veteran who suffered congestive heart failure and how the VA Maryland healthcare system has helped her through the recovery process. So please join us. Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland Healthcare System that provides the latest health and benefits information for Maryland veterans, their family members, and the local community. I'm Kenya Griffin. According to the Centers for Disease Control and Prevention, heart disease is the leading cause of death for men and women in the United States. So joining us to educate us about heart disease is Dr. Shawn Robinson, the Chief of Cardiology for the VA Maryland Healthcare System. Dr. Robinson, thank you so much for joining us.
It's my pleasure to be here.
So let's start with a layman's term definition of heart disease and the range of diseases that affect the heart.
Sure. Heart disease is often used to represent a number of conditions. Some will refer to it as cardiovascular disease as well. And it can encompass the heart muscle itself being weak, leading to symptoms of heart failure. It can relate to cardiovascular disease or clogged arteries, which can lead to heart attacks, something we're very concerned about. There are moving parts within the heart called valves, and they can be dysfunctional. That's a form of heart disease. And then the heart is an electrical organ, and so there can be problems with what we call arrhythmias, where the heart rhythm is out of whack, and so we have to deal with that too. So there are a number of conditions, but those are the big ones that we face when we call someone having heart disease.
And I've heard about coronary disease. What is coronary disease, and what are some of the risk factors associated with that?
So that's the big one. And coronary disease means the vessels or blood vessels that supply blood to the heart muscle itself are clogged, and they can be partially clogged or completely. But when those vessels get clogged, then it deprives the heart muscle of needed blood flow. And that can result in symptoms of chest pain, or what we call angina. And when folks are exercising or walking down the street, if they get chest pain, they may feel a sensation or pressure in their chest. That is a sign of someone having angina. Risk factors are a number of them. We ask patients to be aware of at least 5 important risk factors. One has to do with family history, and knowing if your parents or your siblings have heart disease, where they've had angina or heart attacks or needed bypass surgery, any of those things that relate to having a clogged artery of the heart, coronary artery disease, is something to be aware of. So even if you feel like your brother or sister was doing all the wrong things and you're doing all the right things, if they're a sibling and they've had heart disease, you should look at yourself a lot more closely and ask your physician, or inform your physician that you have a sibling who had heart disease, because that means they have to evaluate you closer.
You mentioned doing the wrong thing, and over the years I've done several shows, and preventative measures such as diet and lifestyle are always mentioned when we talk about how you can prevent developing certain diseases, or how you can attempt to prevent them. What preventative measures can one take to help prevent developing heart disease?
You're right. A lot of the risk factors that can cause clogged arteries, coronary disease, can be preventable, or at least modifiable. Now, you can't modify who your family is, but you can make sure that you're not making that risk worse with behaviors such as smoking. Smoking is a huge contributor to coronary disease and heart attacks. And even though many people may associate it with lung disease and lung cancer, smoking is a very important cause of heart disease. And if someone can stop that, that makes a big difference in their future risk being less for having heart attacks. And exercise, like you said, exercise is the American Heart Association recommends walking as the best exercise because it's the one that's easiest to do. You can just go right outside your door and start doing that. You don't have to join a gym. And 30 minutes, if you can, of uninterrupted walking is a very good aerobic exercise. And that will keep in check some of the other risk factors we're concerned about, like being overweight, and that leads to high blood pressure, and with obesity can be diabetes. So we worry about diabetes, we worry about high blood pressure, high cholesterol as contributors to someone having clogged arteries and developing a heart attack.
What about some of the other risk factors besides your family history, age, gender? How do those risk factors play a part in developing certain heart diseases?
So each risk factor is sufficient for someone to develop coronary artery disease and a potential heart attack. So just smoking alone can do it, but if you're not a smoker and you have high cholesterol, that's all that's necessary if it's not kept in check. And that means seeing your physician recommending a diet that can lower your cholesterol, and if the diet alone is not enough, then a cholesterol lowering medication. So being on top of what those risk factors are, and it's not easy to know as a non-physician or non-health professional, so you have to see your physician and they can identify to you what your risk factors are and how you can modify them.
So the bottom line is make sure you follow up with your regularly scheduled appointments and check in with your physicians.
There's a saying that would be know your numbers. So the numbers would be your blood pressure numbers and your cholesterol numbers. And if your physician can inform you of those things, and if they're concerned and how to modify them, that can go a long way to preventing heart disease, coronary artery disease, and heart attacks.
Dr. Robinson, I understand that the risk factors for stroke are related to those of heart disease. Can you tell us the difference?
Yes. So when we're thinking about a stroke, which is an injury to the brain tissue, it really is very similar to a heart attack, where with a heart attack we're worried about clogged blood vessels to the heart muscle, and therefore the heart muscle is injured. Well, the same with the brain. So the clogged vessels that supply the brain with nutrient blood flow can also be clogged by the same things: smoking, high blood pressure, diabetes, cholesterol. So in that case, impairment of blood flow to the brain will result in injury to the brain called a stroke. And it depends on what part of the brain is injured as far as how that stroke will be manifest, whether someone has a droop of the face, as someone may see, or garbled speech, or inability to lift your arm because of paralysis. So it depends on what part of the brain is controlling that part of the body and what part of that brain is being injured or affected by a stroke. So yes, a lot of the factors that we encourage people to do to prevent heart disease will also decrease the risk of stroke.
Since some of those factors are so similar, what about the symptoms or the warning signs that you're having a stroke or a heart attack? What are the differences between those warning signs?
So other than those I mentioned, sometimes a stroke can be subtle, but it is a difference. So for a stroke, and I think the important message is whether you think you're having a stroke or you think you're having a heart attack, 911 is the first thing you should do, and it's better to be safe than sorry. And time is, we say in cardiology, time is muscle. So the more time you delay, the more muscle of the heart is injured, and the same with the brain. The more brain tissue can be injured. So it's best to call 911 early, but yes, symptoms can be varied for a stroke. So the symptoms of a heart attack are a little bit more consistent and not as varied as those of a stroke. And often it's mainly a sensation in the chest where it's just a heaviness or a pressure. And men tend to present one way, women a little bit more subtly. Often the most common sensation is that it's very uncomfortable, stops you in your tracks. It could be severe pain or just a lot more uncomfortable. Women may be a little bit more subtle, and perhaps it's, I heard someone say that men are a little bit more hard-headed, so maybe it needs to be more intense of a pain. But for women, they may not have that intense pain, but there's usually going to be something that takes your attention: shortness of breath. You may have some associated nausea. Some people will actually have symptoms in their neck or jaw, and that's a little tricky, but it's still important to recognize that these are symptoms I haven't had before. They're very uncomfortable. I should seek assistance to figure out if this is real problem or not.
Definitely. And what about the tests available throughout the VA Maryland healthcare system to detect if a veteran does indeed have heart disease?
Yeah, so that's a very good point. There are tests, so we don't have to wait, and we certainly don't want to wait until someone develops a heart attack. We can identify risk for the propensity or the tendency to develop a heart attack, and some of those tests are like a stress test, where we'll have someone walk on a treadmill, kind of simulate exercise in a controlled setting. So we're monitoring the heart function, monitoring symptoms, see if the symptoms of chest pressure, shortness of breath develop with exercise, and then we can take special pictures to identify blood flow to the different parts of the heart to see if that's a problem. And then there's a host of other tests. We use echocardiogram to evaluate the pumping strength of the heart, and that's using ultrasound. There are no needles involved with that. But there's sometimes we may have to be a little bit more invasive if the tests are abnormal.
Okay, good to know. And so for a veteran or family member who would like to learn more about heart disease, where should they go? How can they learn more?
Well, I think the first thing they should do is have an internist or a primary care doctor. And that's their quarterback on their team for trying to determine what their needs are. Do they need a specialist as a cardiologist or any other field, endocrinologist for diabetes? And the primary care doctor will identify if a cardiologist is needed, and then we can take it from there. But definitely you should take advantage of the VA Maryland healthcare system and the primary care physician network to know what your numbers are, blood pressure, if you have your cholesterol, if you have family risk, they can identify what those are.
Great.
So very helpful.
Well, we're going to take a short break, but when we return, we'll learn more about heart disease, so please stay tuned.
There are numerous benefits for a veteran to enroll in the VA Maryland healthcare system. Number one, they get excellent health care. There's a great pharmaceutical service. They have specialists in all of the areas and use cutting-edge technology. And we have a very good electronic medical health record.
You can keep your current provider as well as come to the VA.
For our veterans, no matter whether they live in Central Maryland or Eastern Maryland, our clinics are conveniently located to where they live throughout Baltimore and the Eastern Shore.
The fact that there are other veterans here that I can talk to and share common experiences with.
The amount of medical attention that I received has been excellent.
The VA Maryland healthcare system is your VA. It's America's VA. It's the veterans' VA.
Since I've enrolled at the VA, it has been a great decision, and I encourage every veteran to enroll. They will not regret it.
It's important to get a new flu shot every year. It's very easy to do, and it can protect you or a loved one from getting sick. People who are at high risk for the flu are those who are over age 50 or those who have underlying heart or lung conditions.
The flu vaccine is offered free of charge. We do the vaccination in various clinics.
You don't need an appointment. You can walk in and get a flu shot when you show up. Thousands of people die from this, and it's preventable by a simple vaccine.
Welcome back to Veterans Health Watch. Rejoining us is Dr. Sean Robinson, the Chief of Cardiology for the VA Maryland Healthcare System, Dr. Lois Freeman, a nurse practitioner for the Home Telehealth Program, and Ms. Ingrid Williams, a U.S. Navy veteran who receives her care with the VA Maryland Healthcare System. We ended our discussion with talk about heart disease, and we want to pick up our discussion with information about heart failure. So Dr. Freeman, could you please tell us what is heart failure?
First, let me tell you what heart failure is not. Most patients think that heart failure means that their heart is going to stop. That's absolutely not true. What heart failure is the inability of the heart to send blood forward with each heartbeat. So the heart requires that with each beat, blood is moved forward with oxygen, because oxygen is the food for the heart and the blood tissue. So with heart failure, with the heart becoming either dilated or thin or bulky and unable to squeeze effectively, the rest of the body is not able to receive the amount of oxygenated blood that it needs to fulfill its functions.
Thank you. Ms. Williams, what led you to seek care as a veteran through the VA Maryland healthcare system?
I was in the Navy for 10 years, and when I separated from the Navy, I was advised to seek help down at the VA hospital for health care.
Did you have any existing health conditions that made you even think about health care?
Yes, I have high blood pressure and diabetes.
And we talked about heart disease or heart failure, I'm sorry, as Dr. Freeman mentioned to us. And you experienced some symptoms that led to heart failure. Can you tell us about those?
Back in February, I was having shortness of breath and pains going down the side of my chest. And I didn't know what it was, so I decided to go down to the Veterans Hospital to get help, to the emergency room.
And Dr. Robinson mentioned that the symptoms for women can be a little more subtle. How long did you experience your symptoms before you actually sought care?
About a day.
Yeah, it's a long time.
It was about a day.
And what was your experience like, or what type of treatment plan did you have to help you recover from the heart failure?
Well, as the cardiologist, I can say that when we have folks like Ms. Williams come into the hospital with those type of symptoms, we're first worried and concerned that you could be having a heart attack. And I think in your case you were not, which is a good thing. And in fact, your symptoms of heart failure were related to high blood pressure. So I think a lot of folks may think that high blood pressure is just a number, but it can have an impact on various organs of the body. And in your case, it was causing your heart not to beat as strongly as it could, giving you heart failure symptoms. And yeah, in some cases, the symptoms of shortness of breath when you try and do daily activities is a subtle thing, and it may be the straw that just added one at a time and gradually not noticed until that day before you went to the hospital when you realized something's wrong and you went to the hospital.
Right, and clearly we know that about a third of the patients who have heart failure also have diabetes. So she had two of the most prevalent risk factors for development of heart failure.
Ms. Williams, and you had a stay at the VA Maryland Healthcare System, and what treatment plan did your doctors help you to execute to recover from heart failure?
When I received new medications, and I attended a heart failure class that taught me a lot of things about my diet, exercise, salt intake, and things that I should be taking care of.
Yeah, things that we talked about earlier, those preventative measures. And Dr. Freeman, you mentioned some of the symptoms for heart failure. Do some symptoms of congestive heart failure vary for each person?
Well, yes, they do. When a patient normally develops heart failure, they may not realize that they have heart failure. They may feel fatigued. They're not able to do their usual activity, and at some point they realize something has changed. So we know that as heart failure progresses, so does fatigue, shortness of breath, and later on in the disease, as Dr. Robinson mentioned, know your numbers. We teach patients about know their ejection fraction, in this case, which is how much blood their heart is moving forward with each beat. They develop other symptoms like swelling in their ankles, swelling in their legs, swelling in their hands. They're not able to get their rings off the way they normally do. The guys aren't able to buckle their belts the way they normally would. And so they realize in doing their normal activity, they're having more difficulty going up the step, difficulty walking around the block. So those are the kind of symptoms, and the chest pain and things that Dr. Robinson mentioned.
You mentioned education several times, and Ms. Williams also mentioned the classes. Could you tell us more about the classes you offer to your patients?
Yes, so in the VA Maryland Healthcare System and in just treating heart failure in general, we know that we need the patients to partner in their care with us, and they have to take ownership of what they do outside of the hospital. So we teach them about lifestyle modification, and Ms. Ingrid talked about diet modification, salt being number one, and with the help of cardiology and their primary care provider, we advise them what foods that they can find salt in, because most of the patients say, oh, I don't use salt, but clearly they do. Many foods have salt inherently in them, and then some foods have hidden salt, and most patients don't know how to read labels. We taught Ms. Ingrid how to read the labels so she could know in the course of 24 hours how much sodium she was intaking. And that's another issue, that patients don't realize that salt and sodium are pretty much interchangeable in terms. And then we also talk about fluid intake. We talk about what their medicines are, what the purpose of each medicine is. We don't want them to stop taking their medications. We want them to call the telephone care line, contact their cardiologist or their provider before they stop if they think that they're having a side effect. Is that right?
Yes, ma'am.
We tell them how to refill their medications and whom they can contact. We set up an exercise plan, right?
Yes, ma'am.
She got a pedometer so that she could track her steps as she walks every day. Some of the patients have started off walking about 600 or 700 steps a day, and we have some patients who have now increased to 8,000 to 9,000 steps a day. It's very important. It makes them feel better. And we talk about depression that goes along with heart failure, because that's just natural. It's like moving through the steps of grieving, right?
Yes, ma'am.
Okay. And the pharmacist goes through the patient's medications with them. And sometimes we're able to combine medications, and sometimes we're even able to get rid of some medication that's not necessary. But we want to empower the patient so that when they're at home, they can track themselves and change what they do to keep themselves out of the hospital and out of the emergency room, because I know you have better things you'd like to do. Is that right?
Yes, ma'am.
Okay.
And Ms. Williams, how would you say that the classes have benefited you? What lifestyle changes have you made since attending one of Dr. Freeman's classes?
I've made a lot of lifestyle changes. I exercise more, I eat better, my child eats better. I've just learned so many new things from the classes.
So what would you say to a veteran to encourage them to live a healthier lifestyle?
Talk to your primary care doctor. Take your medication when you're supposed to, exercise more.
That's a good start. Dr. Robinson, did you have anything to add?
Well, I wanted to underscore that with all the newfound knowledge you have, perhaps if you've been implementing those dietary changes before your diagnosis, you might have avoided the heart failure admission and the diagnosis. So it is helpful, the information that you get from your primary care doc and about diet and blood pressure control. I also want to underscore the service that Dr. Freeman's group does. Those classes are invaluable because someone that's diagnosed with heart failure, there's a high likelihood of coming back into the hospital within 30 days for a new heart failure admission. So these classes are very, very helpful in trying to prevent that from happening. And actually within 6 months, there's a 50% chance, half of the patients will come back to the hospital. And the other service that Dr. Freeman oversees is actually kind of a personal monitoring service, which allows veterans to get their weights and their blood pressures monitored every morning. And someone's reviewing those numbers, and if they start to go out of line where it could lead someone to going back to the hospital, you get a phone call, you get a personal phone call to just make sure everything's okay, are you still up on your medicines? And it's a very wonderful service that the VA offers for our veterans that have heart failure diagnosis.
And that's the home telehealth program,
home telehealth program, yes.
Is it for veterans? What types of veterans qualify for the home telehealth program?
Any veteran that has uncontrolled heart failure, high blood pressure, diabetes, any mental health disorder, and any veteran who wants to lose weight. Those are the usual diagnoses that we accept.
And Dr. Robinson, what diagnostic tests are available to detect if someone has a congestive heart failure?
The simplest test that we order is an echocardiogram, which uses ultrasound similar to looking at babies in the womb. And it can measure the pump or the ejection fraction, the pump strength of the heart, the dimensions of the heart, the size, and that guides us to how we monitor and administer medicines.
And can you tell us more about the treatment options available for someone who suffered a heart failure?
Well, medications are number one, and then all of the information that Lois provides in her classes is a big number two, and the combination of them following up with their physicians to make sure that the symptoms don't recur. And in many, many cases, the heart pump strength gets better, gets stronger and back to normal.
That's great to know. And how can veterans learn more about how to prevent heart failure?
Probably going back to knowing your numbers, being engaged with your primary care physician, so your primary care physician can tell you, they're better able to look under the hood and see what's not right. And you may feel fine. People will call hypertension or high blood pressure the silent killer because you don't feel bad with high blood pressure. It's a myth that you have a headache when your pressure's high. So it's very important to follow up with your doc so that he or she can tell you, what needs to be tweaked a little bit.
Okay. Well, in closing, wrapping up, is there anything else you would like to add and share with our veterans to encourage them to live healthy lifestyles? Dr. Freeman?
Yes, I'd say if you develop anything out of the ordinary, you know your body better than anyone else does. Call the telephone care line, come to the emergency room. We would rather you come for us to tell you there's nothing wrong than for you to sit at home and then have something adverse happen.
Dr. Robinson?
We're here to take care of our veterans, and whatever you need, we want to provide you the best service possible. And prevention is always better than taking care of the condition after it's been developed. So please come and use our services.
I'd like to thank you all so much for joining us and having this discussion. Thank you, Ms. Williams, for sharing your experiences with your fellow veterans. We definitely appreciate it. And Dr. Freeman, thank you for your expertise.
You're welcome.
Dr. Robinson. Before we wrap up this edition of Veterans Health Watch, I also want to encourage veterans to get your annual flu shot. This is flu season and the flu changes every year, so it's important to get a flu shot every year. Free flu shots are available throughout the VA Maryland healthcare system for enrolled veterans, so please get your annual flu shot. And that wraps up this edition of Veterans Health Watch. So if you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101. Or you can follow us on Twitter or Facebook, or even visit our website at maryland.va.gov. And remember, if you are a veteran or you know a veteran who is not using the VA Maryland healthcare system, please contact us. Come into one of our facilities or find us on the web at maryland.va.gov. We look forward to serving you. We'll see you next time.
I think one of the exciting campaigns that the VA Maryland healthcare system has embarked on is the TeleVet campaign. As a veteran myself, I'm really more interested in what a fellow veteran's perspective on their healthcare service is going to be. So I would really encourage all of our veterans who have been to a VA Maryland healthcare facility to tell fellow veterans about their experience.
I wish someone would have told me about the VA healthcare years ago. If you see a veteran, ask them if they're using VA healthcare.
Make a difference. TeleVet.